So, hey, welcome back to another episode of Open Heart Surgery with Boots. If you've been along with me for a few weeks now, I have been re-interviewing a few heart patients that were some of the original friends I've made through this podcast in a series called Hope for the Holidays. If you haven't gone back and listened to those, I highly recommend it. It is really amazing the perspective we heart patients gain through our experience. And then once we kind of let things percolate and cook and ferment, it's amazing, like a couple of years, and for me it's 4 years, how like our perspective continues to shift and grow. So I do recommend you listeners going back and checking that out. And to round out the series, I am so excited to welcome today Dr. Laura Suarez from the Mayo Clinic. And I want to tell you real quickly how I got to meet Dr. Suarez. So I was at the Mayo Clinic in October 2024 of this year for Women Heart. It was my second time participating in the Science and Leadership Symposium. I am something called a heart champion. And basically what we do is we are advocates for women with heart disease across the United States. And we get to mentor and help educate people in our communities. I'm using my podcast as my platform. And Dr. Suarez was there and gave an incredible talk on cardiac psychiatry. Am I saying that right, Dr. Suarez? So yeah, so it was amazing, and I thought to myself, if only I had had her in my life 4 years ago when I was facing my open heart surgery. So I like quickly ran up to you, Dr. Suarez, like a fangirl afterwards, and gave you my business card and invited you onto the podcast, and you very, very graciously said yes. And amongst all your incredible things that you do, and if I may just real quick brag about you, I am looking at your incredible bio. It's amazing what you do in your days. I have so many questions about it, but you're a board certified consultation liaison psychiatrist, which I'm going to want to hear about that, what that means in a second, with expertise in the impact of psychiatric illness in the adjustment and trajectory of patients with chronic medical illnesses, mainly psychocardiology. And that's just amazing to me. And I have so many things I want to unpack with you there. And you originally come to us from Bogota, Colombia, correct?
Correct.
Yes, but then you've done so many incredible things between then and now at the Mayo Clinic, and the things that you research. You are your clinical focus is on the treatment of patients with medical conditions and comorbid psychiatric illnesses, with a primary focus on patients with cardiovascular disease. I cannot thank you enough because I talk to so many patients who struggle, and I see it in like Reddit platforms and on Facebook platforms. And I just couldn't believe that it took me 4 years going to the Mayo Clinic and hearing I did hear you in 2023 in the virtual science and leadership symposium, but I don't know if I was ready to let that sink in yet. It's just such a big topic, and I just cannot wait for you to educate us on the nuts and bolts, and then we'll get our hands dirty as we dig into all the great things that you do. So welcome.
Yeah. Well, thank you so much for the invitation. It's really a great pleasure to be here.
So what is the consultation liaison? What does that mean? I've never heard of that.
Yeah. So consultation liaison, previously known as psychosomatic medicine, is the area within psychiatry that focuses on the overlap of psychiatric and medical illnesses. It's a subspecialty training, a fellowship training. And what we do is really focus on the management of psychiatric illness. And when I say psychiatric illness, it can be kind of an array of things. I would say depressive disorders, anxiety disorders, trauma, psychosis like schizophrenia, bipolar disorder, among other, things.
Mm-hmm.
Those patients who have medical illness. So within consultation liaison, there's more subspecialties, right? So there are psychiatrists who focus on, for example, psychiatric illness and HIV, or psychiatric illness and dementias, or psychiatric illness and neurological disorders, or Parkinson's disease. The practice of psychiatric medicine in the hospital, right? There are all different subspecialties. But for me, really, it was cardiology. So I started my psychocardiology adventure over 10 years ago when I started doing research in patients with cardiovascular disease. And that really made me really excited to say, boy, there's so much to unpack and so much to do. This is the field I really want to focus on. So I did my training on consultation liaison, giving myself experience to manage all sorts of patients with medical chronic illnesses, diabetes, surgical medical patients, hospitalized outpatients. And because of the time I've been doing this work in cardiology, now I have the luxury of having a practice with cardiovascular disease patients.
What was like the moment that you knew cardiovascular disease or cardiology was your passion? Is it your passion? Is that fair to say?
Yeah, I think that's fair to say. So I think a couple things. So if we think about, for example, cardiac illness, is the number one cause of death, I would say, worldwide. It touches so many people. And what we've learned is it's not a one problem, right? There's so many contributions to cardiac illness, and actually there's a lot of environmental problems, and that includes psychological health, our behaviors, how much we exercise, how easy it is for us to do a healthy diet, why do we drink sometimes or smoke, or how do we cope when we're stressed, not to say stress alone. And part of my research back then was that how to help people engage in those healthy behaviors. What can we do to improve, the ability to stay, on task in those healthy behaviors? And I thought that was quite interesting because we always think about just do it, and truthfully, it's easier said than done. And then I started to think, well, there's so many layers to that, right? It's not only doing it, but how can I adjust and change all my life and all I have to be able to do this kind of diet or to exercise regularly. And then as a woman and thinking about, especially young women with younger kids, boy, how can you adjust even to that and be able to maintain, your role as a mom, as a wife, or with your children. And last thing is patients who have cardiac illness sometimes develop symptoms that are chronic. I think particularly about heart failure patients who have chronic illnesses, who come into the hospital often with cardiovascular symptoms, whose quality of life is poor. And yet we haven't developed anything to support them, right? There are some things that we're starting to do, but if I was thinking about, patients with cancer or, patients with other chronic illnesses that have a lot of things, surrounding them. And my sense was, why are we not developing programs or establish multidisciplinary care teams to care for these patients who struggle for their whole lives? So all of those things really made me be part of that process and get into this line of work.
Wow. Yeah, I just as like a personal side note. So I'm just think like there's just so much I want to unpack in all of that. You know, I just shared it's been 4 years for me since my congenital heart disease diagnoses. And for those new here, I was diagnosed at the height of COVID, which made it so much more fun, June of 2020. And then I had my surgery January of 2021. And through this podcast, I met a cardiac dietitian. And she and I just did a whole series in October because she changed my life. And she and I started working together just this May. I bring this up because I've always considered myself very healthy. I haven't had a drink in 14 years. I've never smoked. I eat organic. I work out, and I'm like the epitome of like health, right? So when I meet her and she starts educate, and I had her on the podcast months ago, and she just blew my mind. I had no idea the role of nutrition in cardiology in my cardiac health because I wasn't told that by my cardiologist or my surgeon, which is just mind blowing to me. And it was amazing. Here I am, right? Like picture of health. And I'm doing that in air quotes right now because I really wasn't. I thought I was. And it was really incredible to me how long it took me to make the changes that she was suggesting, all science based. She is really, her name is Michelle Rothenstein, and she just has, like I said, done nothing but improve my life. I am continuously amazed at how many months it took to start instituting these changes. I needed my mental health therapist to help. And so I just want to normalize. Yes, you're right. It takes so much willingness to reflect and the courage to say, oh, actually, I haven't been making the right changes. I haven't been, and having the grace to giving ourselves the grace
Mhm.
to um, accept that maybe the choices we've been making were more coping than like for our health, right? Which, I mean, coping is a way to help our health because it helps our nervous system.
Mhm.
But at least that's how, correct me if I'm reflecting incorrectly. But yeah, I just want to normalize that, oh my gosh, it's hard.
Yeah. Oh, absolutely. I want to touch on that because I think that's actually a very important point is we are not a heart, right? We're not our lungs. We're not our liver. We are human beings, right? Who have lots of things, right? We have a body, we have health, we have family, we have a job, we have things we like, things we enjoy. We have physical needs, right? If we think about our sexual health. So there's lots of things that make us a human. So fixing a heart is a part of it, and it's a great if you're able to fix your heart. But what comes with it, right? If fixing your heart means that you have to quit your job, that maybe was your passion, or that you cannot run around with your kids anymore, right? What does that mean? Or that you cannot eat, your favorite meal anymore. So all of that really impacts who we are, and we have to sort of think that when illness and this type of illness that make us face mortality, we have to sort of reinvent ourselves, right? How do I be the person I want to be, knowing that I cannot do the things I'm used to do, and that it's not easy.
No, you have to grieve.
So yeah, so that's the first thing I think is we have to first understand that this is grieving, losing health. It's part of grieving, and we have to go through the process of that until we accept it. But it's important to recognize and sort of be okay with feeling that way. So I think in when you say normalizing, I think, yeah, we have to accept that there's an emotional response to what's going on. And it has to be, and we cannot put it aside. And sometimes your cardiologist might not be able to recognize it. But I want to invite people to be okay with feeling, with having an emotional response, maybe being angry, because that's part of the process of acceptance. And that's where it's important to do that. And the other thing, as you mentioned, before, you being a healthy person and doing everything you need to do to be healthy, we always forget about sometimes that psychological piece. So I often see patients who are doing everything right, again, air quotes, but they're angry. They have stress in their lives. They are depressed. They might not be enjoying what they do. They might have a history of trauma as a child or a difficult upbringing. And all of those things really compound and actually impacts the way we do things and how our body reacts. we have one body again, so our brain and our body are connected. And there's a lot of influences. And I'll just give a quick example with heart is when we get excited, our heart races. And when we're happy, our heart races. When we're worried, sometimes actually get diarrhea or our GI tummy. And those things helps us to understand that there is a connection between our brain and our mind and our body, and how we need to really appreciate that connection and how to work as a whole as opposed to dividing, our brain and our heart.
Yes, and I can attest to that. I mean, my husband just had shoulder surgery yesterday, and my heart was skipping, and it's been doing so great. But the day before, my heart was skipping and it was racing. And then yesterday, it was like all over the place and having a party in my chest. And then we had like this big winter storm that hit, of course. And then we get stuck in the car for 5 hours on our way home from shoulder surgery. And it is just amazing how that has affected me physically. Now, I have all the self care skills and I got acupuncture today and everything's calmed down. But yes, it is amazing how I became like the skipping record for 48 hours for shoulder surgery for my husband, right? And it's and I just now I have the awareness of it, and I just talk to my heart and I put my hands on my chest and I take deep breaths and make warm tea and can comfort it. But before I had this awareness, it would be so scary.
Yeah, I think that's the other thing is sometimes even you have those symptoms and it's scary and you don't know what to do. And now sometimes realizing that there might be a component of anxiety or stress gives you permission to do something about it. And that actually is helpful because you have some tools you can use, and maybe you need to still go and see your cardiologist and do that, but you now have other things that you can do and perhaps decrease, the severity of the symptoms.
Right, exactly. And probably 4 years ago, I would have run to the ER because I didn't understand. And in the communities that I am part of, and like Reddit and some Facebook support groups, I see people posting, "Is this normal? Should I go to the ER?" And it's I mean, I'm not a doctor. I can't give medical advice, but I can see myself reflected in those questions 4 years ago, right? And so that brings me to the next thing I wanted to talk about, which is, I mean, we could talk all day. This is so amazing. I'm just so excited you're here. um, how, like I said, I had not heard of you and the type of you, right? So how it doesn't seem like what you do is commonplace across the United States. Am I correct on that?
Yeah, so there's actually a number of groups working on understanding the overlap between psychological, psychiatric illness, psychological health, and cardiovascular illness. Now, what I think it's a lot of this work is research. So we do a lot of research and investigative work in learning about the connections. And I would say in the early 2000s, there was a huge load of information about there is reality with this connection. Actually, depression and depressive symptoms have been strongly associated with um, worsening of cardiac symptomatology and even development of new events that really actually put this idea as a risk factor. Even the American Heart Association embraced the fact that we need to really identify depressive symptoms. What I've noticed happened is we do the research, we identify the problem, we kind of get it out there, but then it's hard for us to move to the practice. And in part is because we're still learning and we're still working. And part of my kind of argument or when I wanted to become more be able to practice this, I said, well, we cannot wait until we know it all because it's going to take some time. So we need to do two things. We need to go out there and start doing what we know how to do, help patients, help cardiologists, in this area. And then at the same time, learn from our patients so we can continue to do research and develop treatments. Because, there's a lot still to learn, but I think that's what I wanted to do. I would say there's a few groups. I think one in the East Coast. There's a group in Canada who've done more of that practical work and that translational work of from research to practice. But psychology and psychotherapy has actually evolved some more. There's more of those psychologists doing that kind of mental health work in cardiology. So I think that's sort of picked up more than us in psychiatry, working with patients. But hopefully it will continue to evolve. I see, for example, a lot of the trainees and medical students who are actually interested in learning about this. So eventually this can become more of a standard of care, actually, than just a one-off.
Incredible. That warms my heart, pun totally intended. Um, what, like, do you have is a portion of your job, educating, like getting the word out, like, hey, this is what we're doing at Mayo? Because I didn't y'all mention at Science and Leadership that there's like a 20-year lag between like the research and then when it's kind of like the rubber meets the road to help patients on a more national scale or global scale.
Yeah, I think, at Mayo, of course, we've started to develop this program and helping, other departments and specialists to really think about the importance of psychological health and mental health. And then the other part of our work is really trying to fight stigma, because one of the big problems that we struggle with in psychiatry and psychology is that there's a lot of stigma for mental illness. So people are embarrassed and are afraid of saying they might be depressed or that they have an anxiety disorder. And it's sort of better to just bottle things up and don't share anything and kind of go with the flow. And we're starting to see more spaces for mental health, care. I think if we incorporate psychiatric care in the standard of care practice where cardiologists, GI docs, primary care providers do that work, I think that normalizes it. Insurance companies have started to also help us covering mental health needs because that's a big barrier, right? If you need to go to a therapist and you have to do out of pocket weekly for 12 weeks, I mean, that's pretty daunting. So I think we're starting to see more of that openness to mental health. And again, I will emphasize is the really understanding of that it's one body, right? The brain and the body are connected, and just natural there's gonna be some exchange, and that's starting to become more common, and opening those spaces for patients and for providers certainly
Right.
too.
Right. Okay. So what's your advice then for all the listeners out there like myself who are in front of their local cardiologists, and give us some basic vocabulary questions, statements to help us advocate for ourselves. And I mean, I love my cardiologist. She really is incredible. And I feel like I've won the lottery with her. But she's one person. And before I let you speak, I just want to share one other thing. I had a naturopath on a while back that actually specializes in the MTHFR mutation. It was a fascinating conversation. And something she said really just hit me in the right necessary ways, which is we can't expect any one medical provider to hold all the answers, to hold all the knowledge, right? And I realized that I had been kind of expecting that of my cardiologist. And so it's like we really have to build these teams behind us. But yeah, that's just a side note. But I do think it applies to what I just asked of you. Like, how do we? Yeah, we just I also I swear I'm going to let you talk in a second. But I've had several patients or listeners tell me that they've learned how to advocate because of this podcast. And so this is like your teachable moment of like, help
Mhm.
us help ourselves when we sit down with our cardiologists.
I think that's really important. And I would say multidisciplinary treatment approach, right? Having a group of people who helps you in the different areas is actually most helpful. We cannot know it all. And we really, the best way to help patients is by actually connecting and collaborating with our colleagues. And that's when you think about my subspecialty, which has the word liaison, that's really what that means, right? How can I connect, collaborate with my colleagues and help the patient move to where they need to go, as opposed to me doing everything. So so that, with that said, I would say first you have to accept that you are having maybe some emotional concerns or some difficulties with your kind of, I would call it, emotional world. So if you feel like you're crying more often than not, or you're not able to really engage and enjoy the things you used to enjoy, and I would say that this is not a physical problem. A lot of the patients do have physical symptoms that don't let them engage. But if you feel like you can do it physically, but you cannot really get the motivation, that should be for you like a red flag that there may be some psychological component to it. And what I would say is that's an opportunity for you to say to your doctor, there's something that's not physical, that it's impacting my ability to engage in life. And I would appreciate, either a referral or your guidance in how to manage that. If you think about anxiety is tremendously common, right? And anxiety is normal to a degree. We all have anxiety to be able to do our life. But when you feel like anxiety is really taking over your life, where you sit down and watch a movie, your brain is going, right? Is nonstop. You're concerned about your health 24/7. Someone is talking to you and your brain is somewhere else worrying about your health. You're maybe searching online constantly about your symptoms. You're checking your Apple Watch constantly for your heart rate. And that's taking you away from life. That's another red flag to say, boy, I may be worrying excessively and I need to ask and see what guidance to get. Those are two major problems that are very common when patients have cardiovascular disease. Certainly, if you know and you've had a difficult upbringing, that you've had any exposure to trauma or to life-threatening experiences, and perhaps you start having nightmares, flashbacks. And it's often that some patients don't ever have any symptoms until they have a cardiac surgery. And after surgery, things happen. And that would be a red flag again to say, I never had these thoughts. I never had my sleep get disrupted with nightmares. I need to ask and see if I can get guidance for it. So I think those are areas, and part of it starts with you accepting that there may be something beyond your physical health. Trusting your family members. Sometimes, family would say, boy, you're different. You're not as joyful. You don't listen to when we're talking, and then maybe that should resonate and give you some indication to get the help you need. Certainly, if you're engaging in alcohol use more than the normal, or smoking, or any unhealthy behavior that was not something you used to do, that also should tell you, why am I doing this? Maybe I'm trying to cope for some problems that I don't know, and then kind of get the help you need. Stress is a buzzword, but I think stress is normal. We all get stressed. But if the stress gets to the point where you, again, cannot function, cannot enjoy, that's another area that should prompt you to talk to your doctor. And again, don't expect the cardiologist to necessarily treat you, but at least put it out there so that person can help you get to the person or the team that can help you with those symptoms.
Right. And as we were mentioning a few minutes ago, it's important to treat, well, just because we all deserve to have a great quality of life, right? Number one. But number two, it affects your heart, it affects your whole body. So, there's many reasons to advocate for yourself. And it's, we deserve good health. We deserve happiness. We deserve joy, peace. We deserve to advocate for our health. We are in the driver's seat of our health care.
And I would add that the fact that you've had a cardiac event or have cardiac illness should not take you completely away from having an enjoyable, meaningful life. And sometimes pain and physical health does takes us away from that. So thinking that you could certainly regain the meaning of life despite of having an illness, but you may need someone to help you in the process of adjusting to that. What do I need to reinvent myself to get that meaning back? But don't feel like because you're ill, sort of that's it. I should feel this way.
My whole body just relaxed when you said that. And I think, I don't know if, my surgeon told me to go live my best life at my 6-week follow-up after my open heart surgery, which was awesome. And I continue to replay that in my mind. He was just so thrilled for my outcome. But I don't know if it's commonplace for heart patients to be given their permission to thrive.
Mm-hmm.
Not that like they're being told not to thrive, but like to set the intention of, you're going to go out now and kick ass, like, that was the whole point of my podcast. Was I kept talking to people who weren't necessarily thriving and felt alone, and I felt like one of the lucky ones who was doing well. And I feel like I've had to claw my way to get to where I'm at 4 years, but like I'm living a really beautiful life that I never thought possible. But there's a lot of people out there who, like, stay in that victim mindset. I definitely was in the victim mindset for a while. I got mad. I went through all the stages of grief. But even just hearing you say it again, like, we can have amazing lives, like, that's my spin on it. Like, I still needed to hear that again today.
Yeah, and I would say the survivorship mind actually helps recovery.
Say that again?
That survivorship mind, right?
Oh, okay. I've never heard that. Say more.
And there's actually some work about being a survivor versus being a victim. What I would say is that takes time to get there. Don't feel like it's easy to have that sense of survivorship, but it takes some time. And that's another reason to ask for help, is if you feel like that victimhood has become really part of who you are, and it's really hard to get out of your physical symptoms. They're sort of your new identity and sort of driving your life. That's something that I always say, well, that there might be something else that we're missing, and then that's another reason to get some psychological support.
Incredible. Before we wind down here, I wanted to give you the opportunity to shout from the mountaintop. Like, what, for 2 reasons. One thing you wish all patients knew, and then one thing you wish all cardiologists knew.
Okay. So I think I will start with patients, and I would say 2 things. The first is knowing that this is hard, right? And I will speak about self-compassion, because I think oftentimes we forget about that. And we get into the mode, almost autopilot, of doing all the things they tell us to do to recover, but we forget about the process of that and how difficult some of those things could be. So I think the recognition that this might be a hard part of your life, and that we need to always have some self-compassion, be kind to ourselves, be concerned, and get the support you need, which is the second thing that I'll add. Kind of thing about support is you're not alone. Even if you feel like you're alone because maybe your healthcare team doesn't get you, or you don't get the help you need, there's a lot of other resources and people who can help you. Primary care providers are very well trained and actually manage a lot of our patients with psychiatric illness. So they are a great resource. There's a great number of psychotherapists and psychologists that can also guide you. And although there's not enough psychiatrists, as many as we would like. I think there's also enough of us to help you. So always remember that you're not alone. You can ask for help. And I think important is to recognize you need help, because then that becomes a barrier. And then be able to do that with kindness and with compassion. Now, for cardiologists, the one thing I would like to know is that untreated psychological and psychiatric illness impacts cardiovascular outcomes. So someone who has severe depressive symptoms or depression and has cardiac events, we know that they have a higher risk of having more cardiac events. And there is a connection both biologically within our bodies that connects depression, anxiety, and cardiovascular disease, as it is environmental, right? People tend to eat unhealthier, tend to do poor coping skills like smoking and drinking. They are more sedentary. I've done some work before, and optimism, for example, helps patients be more active. And if you think about, when we wake up and we're feeling tired or more pessimistic, it's really hard to get into the treadmill and do some running, as opposed to feeling really excited. So the negative affect really impacts the way we do and connect with our bodies. So it's important to recognize that if this illness is present and is not treated or addressed in the way it should, getting cardiac illness under control is going to be very difficult. And that I personally advocate for multidisciplinary approach. So not feeling like they have to be the people treating, symptoms they might not be comfortable treating, but that we can work together to give best to our patients.
Whew, I have chills. That's incredible. What for the listener out there who's really struggling to make these like initial changes that might have some unhelpful coping strategies, is that a good way of wording that? Okay, what do you want to say to them right now?
I think that, again, it's part of the process, and change is really hard. I always think about how we have habits. Our brain is very good about learning habits, and we oftentimes live our life in autopilot. So if you think about stress, and let's think that every time, for example, we get home, the way we sort of reconnect is by watching TV and eating a bowl of cereal. And we've been doing that for 5 years. The brain learns that habit. So every time we open our door, the brain is going to immediately sort of recognize that it's time for couch and cereal. So it's something that it's automatic. So part of the idea is we need to change those habits with good habits. But that takes time, right? Because of course, we've had years in the making of having this bad habit. So the first thing is understanding that it's going to take time and effort to make those changes, but that our brain learns. As they learn bad habits, it learns good habits. The other thing is that we sometimes give ourselves big goals, too big. I'm going to run 1.5 miles 5 days a week. Well, if you haven't exercised for a while, that's probably too much. So I always like to talk about something called SMART goals, which helps us really, what I would summarize as baby steps, right? Having really small steps to get us where we need to be. And if you think about you needing to do multiple things at once, well, pick one, because you're not going to be able to change all of them. And start small. And when I say small, is if exercise is going to be your goal, the first thing would be to take your shoes out and leave them out. That might be just the beginning. And then from there, you can start, right? Now you put your shoes on, and maybe you watch the same TV and the same cereal, but with the tennis shoes on. And then as you go, you keep increasing that goal into more exercise or more specific to exercise. And in that way, you're going to be more successful at making the change. And also it's going to feel less sort of difficult. Because when you put big goals on yourself and you're not able to accomplish them, it really feels like a failure. So sort of it's that defeated sense of, why try if I never make it? Mm-hmm. But perhaps it's because your goals are too big. And then the last thing I would say is that sometimes we need accountability. Because again, our brains and our bodies are used to the way we live. So we need to really have that accountability to be able to exercise change. So maybe it is my son who's going to take me out with the tennis shoes. Or it is my dog who's going to make me walk. Or maybe my friend will call me every time I get from work. And instead of me sitting on the couch, I'm going to go to their house and walk. So that support is important, because being and doing things alone tend to be more difficult.
Right. And I can attest to the small incremental changes, because that's what I did with the cardiac dietitian. We just started with breakfast, and I did that for a month. And then we layered in dinner, and lunch was last. And it took months, and it was all of a sudden, I thought it was going to take forever at the start of it. And then, we all know how fast time goes by. And, now it's like nothing. It's just this automatic, more healthy choices when I go to the refrigerator. So I just, just as a side note of like, yep, I get that. Start with the tennis shoes, start with the breakfast. This has been great. Anything else that we haven't covered that you are just wanting to talk about?
Well, the last thing I would say kind of from that is recognizing what also is getting in the way. And sometimes it's psychiatric illness. So if you're depressed, your ability to get up and do things is going to be diminished. When you're depressed, you're going to be craving carbs, not carrots, right? So if we don't treat that, it's going to be really hard, even if it's a small goal. So make sure that as you put those baby steps in, you also recognize what are other things that are getting in the way. So you get all the help that you need. I would say that treating psychiatric illness is doable, is safe in patients with cardiac illness. So sometimes there's a lot of fear, but I would say that it can be very successful, and it's just giving yourself the opportunity to at least understand what treating psychiatric illness and psychological stress means.
Thank you so much. You kind of froze there, probably because I'm on the side of a mountain in Idaho. Definitely has nothing to do with Rochester, I can tell you that. Yes, and I will say, I broke my leg almost a year ago, and I did get sad because it was a really sad event. I was very sad. So I had all kinds of things I had to undo. And I was craving carbs. That is very real. So, yes, it was a very sad event. So, well, Dr. Suarez, thank you so much for your time today. If people would like to find you, what is the best way? I can put it in the show notes, but would you like to verbalize to us the best way to connect with you? Actually, do you want to be connected with? I should ask you that.
Yeah. So I don't have any kind of public presence. I'm not so huge into social media, so that makes it challenging in terms of finding me, publicly. I'm part of the, of course, psychiatry and psychology department at Mayo Clinic, and of course, this podcast is something I do personally and independent of the clinic. But if you get care, if you have that's the place I work. I collaborate. The Academy of Consultation-Liaison Psychiatry is the group of psychiatrists who get together once a year and exchange ideas. So I do collaborate with a number of other practitioners around the country who are doing this line of work. So those are, I would say I would ask your doctor about, the possibility of a psychocardiologist or a consultation liaison psychiatrist. And if there's any way you could get to me, I'll be happy to help you.
And I have had the benefit of going to the Mayo Clinic, and it really is, as a patient, and it really is unlike anything I've ever experienced as far as just feeling cared for and seen and heard. So thank you for being a part of it. Thank you for today. I can hardly wait for this episode to hit the airwaves. And thank you from my heart to yours for everything you're doing for us, for we cardiac patients nationwide, worldwide.
Yeah. Well, this was really wonderful. I appreciate the invitation and the space to really share this line of work, which, as you said, it's not many people know about. I would say that it's cardiac psychiatry, but also you can find it as psychocardiology. In Europe and Australia, that's the term they use the most. So if you want to learn a little bit about those two terms, will get you some information. But so excited to be here. Thank you.
Yes, thank you. So you've heard it here today, listeners. Thanks again for joining us as we wrap up Hope for the Holidays. I deeply, deeply hope that the series has fed you, has given you hope and inspiration and things to think about as you head into the holiday season. I, for one, am not a huge fan of the holiday season, so I'm also doing this for myself. This is my own self care of surrounding myself with people who are joyful and wise minded and are thriving despite their circumstances they've been dealt. So I hope that this has been helpful, and I would love to know if it has. You can send me an email. That's in the show notes. You can always connect with me over social media. Please consider joining our Patreon. We meet up once a month on Zoom, and it has been amazing to see other heart patients come together and form a community through this podcast. So, in case no one's told you today, you are loved, you matter, and your heart is your best friend. Be sure to come back next week for a couple of reruns of the best or the most downloaded episodes of 2024. And then 2025 is already looking really amazing for this podcast. So I can't wait to keep bringing heart patients and healthcare providers to you every week through Open Heart Surgery with Boots. I love you.